Welcome back. We're going to keep things rolling here with our next presenter who's going to talk to us about making sure that we keep a good environment for our students, making sure that we're keeping that psychological safety. So we are very pleased to introduce our own Dr. Kristen Adams. She is a clinical psychologist who is embedded in the University of Michigan School of Nursing as a part of our Counseling and Psychological Services, or our CAPS office. She enjoys working with students at all levels and is passionate about student mental health and wellness. When she's not at Michigan Medicine or the University of Michigan, she can be found enjoying bubble tea, traveling, or playing with cats. And we're very happy to have you, Dr. Adams.
Great, thank you so much. I am so thrilled to be here with you all this morning. I know that some of you, a couple years ago, before the pandemic, many lifetimes ago, it feels like, may have been present when we talked about the concept of psychological safety, especially in clinical simulation learning for both undergraduate and graduate students, but just students in general. And so today the hope is to revisit some of that, especially for those of you who it is likely newer to. So I don't have a set of slides per se. I do have a handout that I will make sure gets your way after our presentation today. But I am hoping that our time together, the next 45 minutes, an hour, can be as interactive as possible. And so for those of you who feel comfortable to, please, when asking questions, if you want to just unmute yourself and feel free to speak. I know it becomes really awkward over Zoom when different people are talking at different times. You can use the raise hand function. You can type in the chat, but you all are experts in this area of teaching and working with nursing students and education. So I think that it'll be really rich and add to our discussion. So without further ado, I am here to talk a little bit about the concept of psychological safety, which may be a newer concept to some of you. It may not be to others, but it is a concept that is incredibly, incredibly important in, I would say, all learning contexts, all group contexts, and it's especially important in applied learning contexts, so such as clinical simulation, but also outside of sim lab and all that on the actual nursing floor as well. So I'm curious of those of you present, when I say and use the term psychological safety, I'm curious what comes to mind for you all. Because I know for me, it means one thing in one context, maybe something in another context, but putting it in the context of nursing education, clinical simulation, working with our students, what comes to mind for you? And again, this is a really broad topic, so really there's no right or wrong answers, there's just general ballparks. And forgive my cat, he's being somewhat needy today, so I'm making space for him.
So I will start us off. So this is Megan from University of Michigan. I did put a note in the chat for our participants around the world. You can also type things in the chat in response to questions if your bandwidth is low. And I'll actually muddle. Oops, my unmute is not unmuting. So, there I am. All right.
Oh, we can hear and see you.
Okay, great. So I guess for me, it's connected to some other things like So feeling like you won't be jumped on or overly criticized if you make a mistake, particularly in team simulations. I think there's a lot of fear around that. And I also think some level of confidentiality. So that what I do or say, if I'm being open about my thinking and maybe how I went astray in a sim, that the people aren't going to be gossiping about that later. I think students care a lot about what faculty think of them, but also about what other students think of them.
Mhm. Absolutely. Absolutely. I really appreciate that. It looks like we have in the chat as well. And if I'm mispronouncing people's names, please let me know. Bjorn says, I think that students feel comfortable to do the simulation and can manage their emotions. Yeah, that's a really good point. I think what both Megan and Bjorn have shared, it's about, there's an emotional aspect to it. And I think that's inherent when we talk about psychological, because that speaks to our psyche and our emotions. And what I like to liken it to is really that it's an environment in which trust is created, built, and fostered to allow for that emotional expression and that emotional experience without, as Megan said, the fear of negative repercussions or threat or harm toward oneself, not necessarily physically, but psychologically, emotionally. And so I have some notes that I'm going to read off. But something that's important around psychological safety is that it is a concept that allows one to be able to show up and employ oneself without fear of negative consequences to self-image, status, or career. And so thinking about that within the context of being a student, students are incredibly vulnerable. They're here, they're learning for the first time how to be a nurse. These are incredibly nuanced and high-level concepts that are new for most, if not all of our students. And there is a ton of vulnerability in not only knowing the material, but being on and performing the material, and knowing that in order to master it, mistakes are going to need to be made. And so in order to make those mistakes and learn from them, that psychological safety and trusting environment needs to be created. It's also a place where individuals can feel safe to easily speak up and share their thoughts, their perceptions and opinions without risking retribution or embarrassment. And so, as was said earlier, this idea of, someone's not going to jump on me, that we're not going to chastise people because they may have done something incorrectly on the simulation mannequin. Yes, there needs to be remediation and correction, and it's important to make sure that there's an environment where that feedback can be critically received in an open fashion. And then lastly, it's defined by how members think they are viewed by others in the group, and its focus is on being respected in a group. So when we talk about the concept of psychological safety, we're talking about the idea that one feels not only a part of the group, but also feels like they are seen as an equal in the group with their peers, are respected by the authorities of the group, and are trusted in the group to be able to perform and learn from those performances. So I'm going to share that handout now that we have prepared for you all. So just a basic definition, much like we said, it comes from the model of team effectiveness, and it's being able to show up and employ oneself. And I realize there's a typo there, without fear of negative consequences of self-image, status, or career. And it's a shared belief held by members of the team that the team is safe for taking risks. So what we want to see in SimLab is people taking risks in these decision-making situations and know that they can make a mistake, because then when they're on the floor and actually performing it, they'll be able to refer back. Questions about the concept of psychological safety at this point? Or the concept, the idea, what it is, all of that. Okay. And if questions come throughout, again, please feel free to step in. All right. So something that I really enjoy about this concept, I remember a presentation that we had done at U of M a couple of years ago, before the pandemic, as I mentioned. We had used an image of a piggy bank. And I believe Melissa Batish had come up with that concept of how it's a container of something incredibly important, you know, money, there's value to it, hard-earned work, all of that, and how incredibly fragile it can be. And so I think that's something really important when we think of the concept of psychological safety. It's sturdy once it's built. It has an opening to allow stuff to come in and come out. And if we're not careful with it, it can easily be shattered and broken if we mistreat it or hold it in the wrong way. And so if we really take that concept of a safe container, of a piggy bank, if you will, and bring that into our work with our students, that's going to be really, really important. And I also want to be mindful, you know, as Megan had mentioned, that there are, you know, colleagues from all across the globe with us today. This is quite context specific, I would say, to US Western culture. Please feel free to adapt this as this might fit or work in your all environments, and you know what makes sense in your educational systems and your cultural backgrounds. But recognizing that this is coming from a more individualistic lens that takes on a more egalitarian, albeit hierarchical, approach within, I guess, US society. So I just want to put that caveat out there as well. So the idea of creating a safe container, holding it, you know, as we would like that piggy bank. You can see it might be a little hard to read, but it talks about the safe container being established when a learner, so in this case a student, can develop a deep level of connection to their motivations, each other, and instructors before the simulation event even begins. And so with that said, what are some ways, some ideas, some techniques, some objectives that you might already be doing or wish to implement in the future to help create that environment to become a safe container for our students, for yourselves as instructors, and so forth? And I'll start, I'll throw one out there. As a non-nurse, though someone who works in group settings and team environments, one thing that feels incredibly important to me is to develop that relationship or those relationships, the rapport. And I'm not saying necessarily that it's required that we be best friends with our students, hardly, actually quite the opposite. And I think it can be helpful to get to know one another on a more personal level. And so, you know, for instance, when Jessica had introduced me, talked about me enjoying time with my cats, but getting to know the person and building that relationship. So Jessica Marzak has also said that she likes to give students a little information about herself before starting the simulation. Maybe the fun fact about pets or something to humanize myself to them. Yeah, so you read my mind. You were typing it while I was speaking it. That idea of just starting off on a more even foot. Again, there's still a hierarchy, there's evaluation, there's power differential, and the getting to know each other, the, decreasing that gap a bit allows for approachability and that safety and trust to be built. Any others? Okay. If any others do have anything they wish to share, you can absolutely unmute, raise your hand, or put in the chat. But something that you'll see, written throughout this, and something that I really want to emphasize is the concept of pre-simulation. And so just to take a pause real quick, Megan wrote, what is harder is safety when it is a sim that is part of the final evaluation. Yeah, yes. So just to clarify, like saying that the simulation that is used as a final evaluation, it's harder to create that or have that psychological safety in space. Is that what you're saying, Megan, I believe?
Yeah, so when we're doing sims earlier in the program, it's very clear that it's fine to make a mistake. We use a lot of reflective evaluation. We've gone to using some of our scored rubrics in a way that it's actually pass fail, but the student can still see how we would have scored it, right? So did you meet the standard in this area? Did you not quite? What are some opportunities to practice the skills that you weren't there yet on? But when we have used simulations as part of a final evaluation, that's more challenging. And I think in some of the contexts that some of the participants in this group work in, there are either simulation or observed clinical encounters that are part of final evaluations. And so thinking about, we can't make those feel as safe to a student, but how can we improve it? And Deb
Absolutely.
has a comment that is great that I saw in here.
Yeah, absolutely. And Deb, thank you so much for sharing that. And I'm definitely gonna speak to that in just a moment. And just to piggyback on Megan, what you're saying, totally. And I think what's so important is the idea that psychological safety is a concept that is, I guess, kind of going to the idea of like the final evaluation, that there might not be as safe an environment or safe a container in that space as I think I was hearing you say. And with that said, if psychological safety is built in the beginning, it should hold throughout. And so, once the piggy bank is created, once that safe container is created, unless it were to be damaged or irreparably broken, it will carry out throughout the tenure of the group. And so I think what's important to say is that negative emotions will still be felt. Negative emotions will still be present. And I know full and well that with checkoffs or final evaluations, it is incredibly anxiety inducing and stressful to be going, doing these skills in the simulation lab in order to prove competency. And that's okay to experience that within that safe container space. And it's the safe container space that allows those emotions to exist in a healthy, fruitful way. And so I appreciate you bringing that up, that, there is nuance to this, that even if there's like a safe container, it doesn't mean that there isn't going to be struggle, there isn't going to be strife. There absolutely is. I mean, this is hard work that our students are doing. They're learning a lot, they're doing a lot. And, learning really challenging concepts. And with that, growth is going to be pain. And if it's done in that safe environment, they'll be better off for it, both in the moment, but also speaking to longevity. So yeah, I really appreciate you sharing that. And then Deb, you had mentioned that sometimes you participate in the initial simulation yourself. And so that way students know that you can make mistakes as well. Absolutely. I think modeling and self-disclosure in that way is really helpful. Okay, it sounded like you unmuted, so I wanted to give you space to talk. But
no, that's okay. I think that it's important to be willing to put yourself out there too, and participate and not expect it to be perfect. So,
absolutely.
And it is how you set the tone for going into the next simulation,
Mm-hmm. Absolutely. Well, and as we'll speak to in a moment, that with that safe container space, students learn from one another through the mistakes that are made. And so like mistakes need to be made, and who better, a person to see it come from the expert, that, you can be an expert, you're a licensed clinician who is doing this work, and still sometimes mistakes happen. And obviously, I'm sure the level of mistake will look different, but knowing that, it happens.
Yeah.
Something that feels really important with that idea of safe container that I want to highlight right here is creating that looks weird highlighted, but creating a strong pre-simulation briefing. And so that allows for that foundational piece. And so by being able to be as open and transparent of, this is what the simulation will look like, this is what we'll be doing, this is how I will be giving feedback, this is a way to receive feedback, this is a way to correct mistakes, this is a way to partner with one another. However you specifically work with your students in the simulation environment, it can be really, really helpful to lay it all out before the process even begins. And part of that is demystifying what the simulation might look like that day or that week, but also being really clear and really targeted in, this is what I'm looking for, and this is how I will let you know whether or not I'm seeing it, whether or not it needs to look differently, and setting up those expectations. So that way, after the simulation is done, they'll know, like, okay, my instructor is going to give me the feedback throughout the process, or they'll give it to me in the debrief, or they'll come over, they'll be taking notes, whatever it might be, just really knowing what they're to be expecting. And that also helps set up that environment. So speaking a little bit about the importance that psychological safety emphasizes for learning, there's really great importance to it. I think even just in the nature of the word safety, we all look for and yearn for safety. It's some might argue it's a basic human need that we have. And so that stands true also with regard to feeling emotionally safe, psychologically safe in our learning environments. And so, as mentioned, the whole concept is focused on being respected in a group, and can allow others to learn from mistakes. So I have highlighted here 4 points that are 4 main attributes of psychological safety, but I want to put into context that this is centered around or created around a learner-centered environment. And so where the learner and their development is structured in the middle, and with the hope that they can grow and learn from that concept or from that aspect. And this also aligns with how a student will perform and act in the classroom or learning setting without fear. So if we're looking at the students' learning and well-being at the core, this is where these principles are really going to come in. And when we take into mind the concept of having a safe container, being in that psychologically safe environment, that means that student learning is at its core. So I'll read them just literally off the page, but 4 attributes of psychological safety include feeling of status or comfort. And so what they mean by status, really that's saying like part of the group, that they're feeling like they're a member of that safe container, if you will. It's also important in that it's a state in which students can perform without fear. Again, I add a grain of salt to that, because as we were talking about with Megan's comment earlier, there is going to be fear, but the fear will be comparable to the task at hand. That if the fear is associated, related to retaliation or retribution, or that one will be made a mockery of, that's when the fear is I can't think of the word I'm looking for, but irrational, I guess irrational, but it's just not commensurate with the level of fear that should be appropriate in that context. And so if there's fear that they might not perform to their best, that's normal, that's natural. We know that a moderate amount of anxiety allows for peak performance. Also a sense of trust toward the group or organization. So this is really important, where you know, not only are they feeling a part of the group, but there's trust that other group members are there to support them, are there to help them when they're learning from mistakes, are not going to ridicule them, and are going to help create and foster and keep that safe container, that piggy bank, together and safe and in a healthy environment. This makes me think of, you know, sometimes there are instances where you may have, you know, 1 or 2 students who maybe present a little more difficultly. They might be someone who is not as cohesive in helping create that safe container, that psychologically safe environment, trusting environment. And that can be really hard to the group dynamic. That's where damage to that piggy bank, that safe container, can come in. And so it is important, as you know, your all role as the instructor of the group, to help support that student and that group, to help make it as cohesive as it can be. Obviously, as one human being to another, you can't necessarily change people or control people and their behaviors and actions. And if there's a concerted effort to bring everyone onto the same level, that feels really important. And then also lastly, that in a psychologically safe environment, within that safe container, there is no anticipation of no harm towards self. And so that if a mistake were to be made, that the student will be able to recover from that, even if it's in an evaluation space. Obviously, if a mistake were to be made, that would have ramifications, but it would be, again, commensurate to the task at hand. That, okay, maybe it means that they're not passing and they need to retake it, but it's not a matter of their livelihood being threatened or their personhood being threatened. It's a matter of, you know, they might need to continue to brush up on their skills and get more learning and take more coursework around it or continue practicing. But it's not that there's irreparable harm in that regard. And so when these 4 things are in place, these attributes allow for a greater self-efficacy, trust, and understanding of the content material. A lot of the time I hear students talk about the idea that that I'm thinking of self-efficacy, where they're like, I don't know if I can be, you know, a good nurse. Like, I don't know, like, what does that mean? And it's oftentimes a huge conversation on the ability to learn, to be open to feedback, to take in information, to grow from that learning, and knowing that a good nurse is not someone who does everything perfectly every step of the way all the time, but rather works toward doing the best that they can do, and obviously maintaining competency, because that is important in this field. And with that trusting environment that's more able and apt to be present. What thoughts or questions do you all have at this point? All right, and again, if any come up, just let me know. I apologize about the lightness. It looked dark. I'm on a different computer right now, so it looked a little darker on my other computer, but this one, it looks a lot lighter. So hopefully once it gets sent out to you all, and if you are able to print it, you can read it a little bit more easily. So what happens if a student is taken outside of the safe container? You know, I keep mentioning this concept of a piggy bank. I'm wondering, like, what happens if the piggy bank is you know, opened up and some of the stuff spills out, or they're physically removed from that space, or there's a gash in the side? What is that then going to lead to? We already spoke to some of the difficult impact that may exist when psychological safety is not instituted, if it's not in place, if it's a bit wobbly to begin with. But essentially, you know, there's the lower feelings of self-efficacy, feelings of unreadiness, anxiety of having mistakes exposed, as well as worrying about damaging teamwork and fear related to evaluation. I will pause for a second for Dr. Oscar.
Yes. Thanks a lot, Kristen. This concept, how do we treat with the fact that there's a school of thought that it is better for the student to kill a lot of simulated patients to get it right, rather than go into the clinical area and actually kill a real patient, notwithstanding that in the simulated environment, we want even the simulated patient to be, even though it's a mannequin, to be treated as a patient. So how are we going to strike that balance? Because we are taking persons, looking at them as from novice to expert. So of course, some of them will have some trepidation, they'll have some psychological trauma. You know, how are we going to strike that balance when in the process of doing, they could end up compromising the integrity of the patient, and yet we need them to have that teaching learning experience.
That's such a good point. And I will also defer to others who are in the clinical simulation experience, because myself, kind of speaking as an outsider in, you know, I'm speaking about this concept broadly, and I really take a lot of value from what you all have from firsthand experience. That being said, and please let me know if I'm not answering your question or your thought directly, and I can clarify. But essentially what's coming up for me in that context is that the hope is, so point blank, this idea of psychological safety, the safe container, I think it can come across as, like, if we're not careful, very coddling, very much like we need to treat our students with kid gloves on. We have to pussyfoot around everything and be really gentle. And that's not quite the case. we can be very direct. There do need to be boundaries. There are consequences. Mistakes will happen, and you know, repercussions of those mistakes will come about. And the whole idea of psychological safety is that those won't, quote unquote, break our students. And so when we're giving feedback directly, when we're, you know, doling out consequences, if you will, when we're giving this information to them and having them, you know, redo or whatever it might be, they can take it in stride and not crumble, really. And part of that is a responsibility of the students, yes. Part of that is a matter, one of you in the chat had mentioned like students managing their emotion. You know, that's part of the side that I work on as well, of like, how can we manage your emotions in this clinical simulation space? And part of the responsibility of the instructor and the group is to help so those emotions can be managed. So going back to what you were saying, Dr. Esker, I think the hope is going into these simulation experiences with the idea that you're still going to try to do your best. You're still going to try to treat every patient mannequin as though they're a real live human being patient. And like, if mistakes are made, because that will happen, the consequences are not going to be as grave. So it's better to make the mistakes here than out on the floor. And so I think, you know, it's not so much that we're, at least, again, I'm speaking as a non-nursing instructor, but it's not so much that we're going in there and being like, oh yeah, just do whatever you want until it feels comfortable. Not saying that that's what you're saying. And this idea of, let's, you know, put forth your best foot, put forth the best effort you can. And that way, if a mistake is made, it'll be made in that safe container space. And so you'll be able to fall with a safety net, so to speak. I don't know if that directly answered what you were speaking to, or if others have thoughts, but I very much welcome any questions, thoughts, feedback around that.
Sure, I can speak to that as well. I do agree. And from the clinical instructor side, like you said, Dr. Adams, when you talk about psychological safety, it does sound sometimes like you're going to coddle your students. But I think it can also do the opposite for you. I think the more safe your students feel with you, the more you can impart the seriousness of what you're doing without completely freaking them out, right? So I do tell my students, especially in those high stakes, CPR, code simulations, if you make these mistakes in the real world, somebody could die as a result. But I can have that conversation because I've already set up this environment. I've already said, this is the place to make mistakes. This is okay. We're going to talk about it. It's totally cool to mess it up. But there are consequences to actions in the real world. So for me, setting the stage in this way actually allows me to be a little bit stricter about things that are serious, I think.
I so appreciate that, Jessica. I think that is so on point, where again, like, you're holding these standards, you're holding these expectations, you're holding these realistic realities of life as a nurse, and it's in an environment where you can do so. So yeah, I really, really appreciate that. That's a really helpful clarification. Yes, there is a message from Civicum.
Oh, okay. Was it posted? Thank you. I thought it wasn't posted. Yeah, because my issue is, how do you handle the, emotional blackmailing, or, when a student is always late or not prepared? How do you, make sure that they are safe without shattering their, emotional, safety? Thank you.
Yeah, I appreciate that. And you know, this is probably helpful for me to clarify as well. Obviously, you all in this space are instructors, and so I'm speaking with you all from the lens of an instructor. And to create an emotionally or a psychologically safe environment, there needs to be buy-in from and participation from everyone. That it's not just the instructor. You might be the leader in creating that environment and the one to, you know, step out there first in outlining it, and all students need to be able to take part in that to help create that safe environment. That being said, you know, as I mentioned briefly beforehand, like there are going to be students that may disrupt the creation of that safe container. They may threaten the integrity of that safe container through some of their behaviors and actions. And while it puts you all as instructors in a hard place because you're trying to not only create but maintain that safety, if someone is, you know, out of step from where the rest of the group is, that can be a huge, you know, vulnerability. And so with that said, I think it becomes a matter of addressing it with the student, you know, personally, and see if there's change from there. And if there isn't or is, I think having continued group conversations. And so creating the safe container, once it's like built and created, it needs to be maintained. And so, you know, just like a home that's newly built, yeah, it's, you know, fresh, it's standing, it's great, all that. And like over time, like you need to repaint it, you need to fix things, you need to repair things. And so it is okay to, you know, throughout the semester, come back as the group in pre-simulation, in debriefing, and check in with each other. Like, how are we doing? Like, how is the way the feedback being delivered? Is that helpful? I know sometimes people have different things going on, and some people are late to simulation. What are ways we can make it easier so everyone's getting here on time? And so allowing it to be a group effort for that group maintainment. And so I think continuing to check in and continue that process throughout your time together is going to be vital to allowing for the health of the group, but also the psychological safety to be nurtured and maintained. Any other thoughts or questions? I'm trying to think. So, okay. So, oh, yes, Megan has raised her hand.
I don't want to derail things though. So, okay. I was just thinking about Oscar's question about, you know, a mistake could have a consequence. You know, a mistake that a student makes in a fictional scenario could be something that might lead to harm or death of a patient. And I think that there's actually been a fair amount written about that, although I can't remember where I read it, but it's a very conscious decision depending on the level of the student group and the learning objectives of the sim. If it's a sim about how we handle loss of a patient, that would be one thing. If it's a possible or probable consequence of a decision a student made in a sim, depending on the level of your student group, you can make a decision to have a simulated patient die and then debrief about that. Or that may be a time where you use queuing to intervene and redirect, and then talk later in the debriefing about what would have happened had the error not been corrected. Yeah, so I think it is a very, in the world of sim and maybe some of the more experienced folks on the call, I think it's a very specific thing in terms of making a decision in advance about whether in this sim we're going to let the patient die and how we're going to handle it if it happens.
Yeah, absolutely. And, you know, again, I say this as a non-nurse, and I think from a psychological standpoint, that can be really, really important, to learn how to not only like navigate something such as that, but also from an emotional standpoint. What has that like brought up? What has that experience felt like? And if it's done in that safe environment, you know, punishment, retribution won't be present, but rather the opportunity to learn and grow from that experience and know how to navigate it differently moving forward. I see, Carol, you had raised your hand.
Yes. Hello. Good morning, everyone. I just wanted to comment regarding students' attitude towards the sim, and I'm going off of Dr. Ocho's point a little bit. And sometimes in the process of doing simulations in the lab, when you find that a student is taking a very casual, almost a cavalier attitude towards the scenario, towards what you're trying to accomplish in the lab, how do you go about turning it into a teaching moment when the student is treating it as something that's very casual or as something that doesn't matter? And what I have found is that when students behave like this in the lab, you'd find again that it oftentimes translates into their approach to patient care on the ward, where you sometimes find that you're reminding the same students, you know, that this isn't a simulation, this is not a task trainer, you're dealing with actual persons, and you can't act on the clinical area with real patients the same way that you would want to do in the lab. And sometimes I find that there are students, and not a lot of them, but there are students who don't get that.
Mm-hmm.
And it's difficult to see how do you get them to understand that. Can we teach effective competencies through simulation?
Mm-hmm. Mm-hmm.
I can
Yes, that's
tackle that
what I
one if you'd like.
Yeah, please.
So I, just because it is more of a clinical question, not that you may not have something also brilliant to say about it, because I'm sure you do. So when I have those students who have more of a cavalier or relaxed attitude, I have found that 9 times out of 10, those are actually very smart students who are kind of bored, who think that this is beneath them or that it isn't worth their time, that they aren't going to learn something from it. And if I know who that student is ahead of time, and I usually do, then I will often assign that student the hardest or the most direct role in the simulation. And I will let them know that ahead of time. Hey, you know, I'm going to give you the role of the nurse. This is the most complex role. Here's some things to review ahead of time. You know, you're really going to have to take a lead in this simulation in order for it to work for everybody. And I give them that kind of, it's almost like a little boost, like, hey, I think you can handle this. This is going to be hard, but I want to see you try it. And if you give them that little bit of a push, often they will do better and they will be more focused and more engaged, I have found. Not always, but usually that'll work for me.
I appreciate that, Jessica. I think, yeah, I definitely want to defer to you all as, you know, experts in nursing education. And the piece that I would also add, and of course echo, but add, I think, you know, as we move into takeaways in the last few minutes of the presentation, the main takeaway is you can do all of that. You can communicate in those ways, much like you said earlier, Jessica, of being more direct, giving that more pointed feedback when the environment is created to be psychologically safe to begin with. And so if nothing else, I hope you all walk away today from this, you know, hour together, knowing that, I mean, I don't want to patronize our students in any way. And like, in a lot of ways, it kind of is like parents with children or caregivers with children of, you want to help foster and create that secure attachment so they can like go out and explore the world, and then they come back and the safety is there and there's still discipline, there's still expectation, there's still standards that need to be met. And so it's not all discipline and it's not all warmth, but rather it's a healthy mixture of both. And so if we think about it from parenting style, it's that authoritative parenting style.
Before we get to takeaways, Dr. Adams, we did have one more question that I was sent in the chat. And the question is, how can we manage students with different competency levels? So maybe there are some students who are a little bit behind, who are not understanding the scenario, and you're very, very smart students who very much understand everything that's going on. How can you increase teamwork? How can you increase confidence while maybe not calling them out directly? Or if there's a good way to call them out directly?
Yeah, and I think, again, I want to defer to some of you all, and taking with what you were speaking to, Jessica, I think this idea of being able to relay said feedback of, oh, it sounds like this skill is a little bit hard for you to work through and it's taking a little more time to acquire. Like, that happens. That's okay. Like, we all have our strengths, our areas of growth. Maybe we can, you can come for extra time in the sim lab. I know at U of M we do that, where you can like sign up for sim lab hours to practice. And I think that idea too of being intentional on what roles you put people on. Can you pair people in groups where there's, someone who's maybe at a higher level of competency and one who's growing in that, and pair them together to help support, learn, and scaffold in those ways. I think with that said, I keep coming back to this, but if a psychologically safe environment is created, not to say feelings won't be had, like everyone has emotions and everyone's way of experiencing and expressing emotions run, on a unique spectrum, true to themselves and different from one another. And it can be more in that mid-range of hopefully experience and expression, as opposed to the extreme of the ranges when that safe container is created, built, and fostered. And so hopefully in such an environment, difficult feedback can be received openly, can be received in a way that, sure, maybe they'll feel hurt, rightfully so. I mean, as a sensitive person myself, even though I love and value constructive criticism, there is that initial like sting of like, oh, I'm not doing this right. Oh, like, or I'm not doing it as well as I can, and maybe blame that on perfectionistic tendencies, sure, which I know a lot of our students experience. And it's okay to feel that because you're in an environment where it's safe to do so. Okay. So to just speak briefly to takeaways, you can see at the bottom, it's really highlighted that trust and respect are essential to cultivate psychological safety. Again, context specific, culture specific, teaching approach specific. It's okay to have different schools of thought. It's okay to hold hierarchy in a different view. It's okay to approach it the way that you believe is best and have grown and have been taught to approach it. And however you do approach your work as an educator, I encourage you to please consider continuing to integrate the aspects of trust and respect. And so respect that the students are trying their best and learning to do what they can, and helping facilitate that trust that if a student might be struggling or are bored, that they can speak in those ways in the group where they can feel supported by one another, and not that they're going to be chastised or, made to look a fool or, whatever it might be. Again, it's really helpful in the pre-simulation, pre-briefing experience to be as transparent and explicit as you can. reviewing the evaluation criteria so students really know what's expected of them and how they'll be evaluated. And then also being sure to debrief with them after and allowing them space to talk about their experience. I guess explain maybe why decisions were made and how that can be rectified. If, you know, they made a decision to put in an IV because of X, when really it should have been something else because of Y, but you can understand why it was X, allowing that space to educate, well, it should have been this instead of the IV because of Y. And then also knowing that when psychological safety is threatened, it can lead to defensive behavior. So it can be helpful at that point to just pause, maybe ask what the student is needing, sharing what you're needing. And I think really when we think about it, being as open, as transparent, and as communicative as possible. So those are a few of the takeaways. As mentioned, I will make sure that this handout gets all your way so it can be distributed to you. If you have questions, you can always follow back up with me. I'm hopeful that my email will be associated with that as well. But I know we're at time, but I do want to make space just to see if there are any final questions or comments, concerns. So Narumo says, how do you assign students into groups to facilitate learning? Do you mix them based on skills, background, or apply a voluntary basis? That's a good question. Again, I want to defer to the educators in the room. And I think just for the psychological safety aspect, both. I think that there is something when we're talking about facilitating learning to have a mix. So like when people have different strengths in certain areas, to help facilitate those who have growth edges in other areas, to help support and grow one another, because that can be really confidence building for those who do have the strengths, and also confidence building for those who have the growth edges, but can be helpful as well.
Yep, I would add to that, that if it's a simulation that you're going to run multiple times, so maybe there's a couple students running it, a couple students watching it at a time, I'll let them choose. I'll let them volunteer first. That way, the more confident students go first, and maybe the less confident ones get to watch and build their confidence before they go.
Mm-hmm. Great. Well, thank you all so much. I appreciate your attendance. I appreciate your attention, your engagement. And if you all have any questions, comments, concerns, please don't hesitate to reach out.
Great. Thanks so much, Kristen.
Of course. Thank you for having me. Take care, everyone.
Thank you.
Bye.